everybody that I wanted to welcome. Thank you for showing up. So this is a third of a four-part session. I'll explain that in a moment. But first, my name is Anne-Marie Parent, and I'm joined here with my colleagues, Kyla and Janine, and also Paloma from the Systems Innovation Health Hub group. And so the whole purpose of this series is really to explore the use of systems thinking tools to try to solve complex problems we have in healthcare. And so through the series of these kind of 1 hour sessions, we've been exploring different dimensions of that and kind of building up to the problem that we've identified in one of the first kind of sessions around, successful aging in place. And so what I would like to do before we kind of get going is just a quick recap. So if you participated in the other ones, it'll just be a great refresher to bring that back into your short-term memory. But if you haven't seen or the recordings or had a chance to participate in the other sessions, this should get you caught up. And also, Janine, just a reminder, in a moment, I'll ask you to explain the systems mapping that you've improved, and you'll notice I did add a few images to it for that, just for the purpose of the exercise today. So let me just get my screen up. And I think, Paloma, we can maybe, so the first screen that I'm sharing is the Miro, where Kyla in the first session was kind of framing a bit of the problem, the tsunami of aging people, 90% of seniors wanting to stay in their homes, and just a growing number of people over the age of 75 in the US, will reach a certain amount of people. Now, this so far, participants in this group have been pretty international, so we're keeping an international lens to the conversation. But one of the tools that we kind of started to explore in that session was around kind of this iceberg model and trying to understand the current system, looking at the current events, the patterns we're seeing, the current structures, and the current kind of mental models we have around this. And that kind of launched a few starting points for our system mapping to kind of understand, well, what are all the connecting factors related to successful aging in place? And so this is where, after we kind of just explored different elements here, and what I would like to point out is, although, there was an international audience, this seems to be a problem in healthcare around aging in place, that there's a lot of commonalities around the globe around this and some of the challenges we're facing. So that was interesting to uncover. And so hopefully, do you see when I move to the second tab here, did that screen change? Yes? Okay, wonderful. So what we did at the last session, and let me just zoom out, and then Janine, I'll ask you to explain your screen in a moment, was the map of successful aging in the appropriate place, that some of the Post-its here were built off of the work we did in the first session with Kyla. And then during that second session that Janine facilitated, we kind of added more Post-its to the system map. And, one of the feedback during the session was quickly this map, is getting pretty overwhelming. And I think part of that is when we try to use the system map to try to really understand all the system and all its parts. And I think a good reminder is, system mapping doesn't necessarily mean that you will be able to understand the full system with all its intricacies, but by starting to map the system, we start to identify potential connection points that we hadn't seen before, or leverage points, like something that seems so powerful because it's connected to many other points. And from there, potentially new ideas, suggestions for what we should experiment with starts to emerge. But this diagram, started to look a bit spaghetti-ish. So thank you, Janine. Janine then quickly kind of took and extracted kind of some of the essential elements. And so maybe instead of me explaining, because I did not do this kind of this simplified version of our system, Janine, do you mind walking us through? And I don't know if it's easier for you to share, to walk through, or if you just want to guide me and I'll move it around. What would you prefer?
Let me go ahead and share.
I think that'll be easier.
I think it'll be easier as well. And so as Anne-Marie said, that's where we started. And for those who want to become facilitators of this or hone your own specific skills, this is pretty common, that when you get a group together and all of the ideas pour out, there are many Post-its and many arrows. At the end of the last session, what we did is say, you know, what is popping out as maybe the more powerful leverage points, the way Anne-Marie described. And we picked intergenerational living. We picked, hang on, let me get a little bit more zoomed in here. So it was, let me back up. A big part of our focus on session 2 was social isolation. So we honed in on intergenerational living and caregiving burden as a couple of areas where we really, really wanted to continue to focus. So all I did was take the map from session 2 and move those things more to center. And then I deconflicted arrows. And so as a point of mechanics, in this tool called Kumu, if you click on an arrow, it turns blue and you can make it change its shape and size. And I simply did that. And I allowed a lot of the Post-its to go to the edge in favor of of what we wanted to focus on. And so there are some little threads here of intergenerational interaction and housing. So we were honed in on intergenerational housing. The other thing I did, and this often happens in the offline part as well, is I added a few connective tissue types of Post-its as proposed connection points. So we were making an assumption that if we have intergenerational housing, it means we're having successful intergenerational interaction, which reduces social isolation. So in a few places, I added those connective tissue Post-its, if you will, to make the logic flow. The other thing I did for caregiver burden, we had overloaded 1 or 2 Post-its with quite a lot. So we talked about the volume of caregiver transactions and the types of caregiver transactions. And I split those apart to say at-home clinical and functional care is different than at-home schedule and activity coordination. And they are all, and the volume of both of those are all inputs to caregiver burden. And then I connected the dots between intergenerational housing and interactions and caregiver burden. So again, there are some assumptions here that if we have intergenerational housing, we're sharing the tasking, which preserves familial relationships, which was a big theme that came out in both of the previous sessions. I'm a caregiver, I'm not a daughter anymore. So all I did as a systems mapping facilitator is clean out the arrows, bring front and center the things that we said we wanted to focus, and add a little bit of connective tissue on them or between them. And when Kyla, Anne-Marie, and I talked last week to prep for today, one of our aha moments was that where we had a lot of arrows and Post-its and passion was about ourselves and about the organizations where we work, not as much about the person we're caring for. So we actually embellished a little bit down here on the social interaction to say, well, what does the person need and want? What is a well-matched social interaction? So it's not necessarily about us saying, hey, here's everything we can do for you, if that's not what the person needs and wants. So we added a little bit there. And if I were doing this as part of my day-to-day work, I would bring this back to the group, much like what we're going to do today, and say, we cleaned it up, preserved the passion and the sentiment of what the group expressed, added a few things to make it gel and to make the logic flow. And now we're ready for some validation of that and for the next steps. Anne-Marie and Kyla, is there anything you would add?
No, but I think I see Tanya has her hand up, so she might have a question for you.
Yeah, thanks. Thanks, Janine. And sorry I couldn't make it with the last session. This looks fantastic. It may be a small detail, but it's part of my learning. So for instance, Janine, when you were sharing in that with the pink stickies where you had intergenerational or education and it leads to successful intergenerational interaction. It's the word successful. So I'm just curious, do we keep it like neutral as a variable. And I know like it's part of the story that people were telling likely. So that's why it's important maybe to leave that word there a bit. But the intention really is that or the thought there is that the whatever is contributing to that would be either increasing intergenerational interaction or decreasing interaction. But the word success, is that important to include or not?
Great question. No right answer.
Okay.
So it's how we view the world. So we could do it without the modifier and simply say it's about the volume of interaction, bad or good.
Yeah.
In my head, my first gut reaction would be to do what I just did, which is add a second post-it for unsuccessful.
Right.
And then what that requires us to do is characterize what is a successful interaction and unsuccessful, and then what causes them and what do they lead to. And the reason my head wants to split them is I believe, and we would toss this to the group, is that they have different effects on social isolation. And additionally, unsuccessful could connect with somewhere, whoops, did not mean to do that, somewhere we have neglect and abuse.
Yeah.
So I'm
And
not
I
sure an
also,
unsuccessful is abuse, but it might be neglect.
yeah, and I appreciate that too, because I'm also where my mind is going is a little bit around maybe cultural aspects to and I was reflecting on your comment earlier that, you know, having those with lived experience really comment on the narrative that you just shared would be really important. So I like that, having the modifier in there for the nature of being able to tell the story and have it resonate for people. I like that. Thank you.
Sure. Great question. Anything else? Kyla, Anne-Marie, anything else?
No, thank you for that overview, Janine. So maybe what I'd like to do now is explain the next steps for today. And I'm going to bring us back to the systems innovation kind of game board to this approach, just to kind of situate where we are in the process and what is the next step for us today. Okay, just sharing my screen. Give me a moment. So at the top, so there's two links that I put in the chat. One is the Miro, and that's where you had a lot of the tools that we kicked off with Kyla, and the Sticky Studio, which I think is kind of a sub tool of the Kumo. Maybe we move before we move forward to that question. So Sticky Studio is not necessarily Kumu. And I'm just trying to see if I can see the chat again here, because I think it's Denise who was asking a question. So did not know you could drop a Kumu map in such a tool such as Sticky Studio. Do you want to explain, Janine, the relationship between Kumu and Sticky Studio?
Yeah, Sticky Studio is a Kumu tool. Like Kyla said, they created it during the pandemic to foster virtual synchronous collaboration. So making it Miro-like, but very much geared towards mapping and mapping only. So there are, you know, fewer bells and whistles, templates, and not a bazillion colors. So Miro has sort of a larger, different purpose. And then the intent is that you can import, export between fully featured Kumu and Sticky Studio. So Sticky Studio is geared for group sessions like this. Kumu is not synchronous collaboration. It's more geared for, you know, putting all the relationships with clarity, doing simulation, doing much, much deeper systems analysis. Was that helpful, or do I need to add more?
Great.
Tanya, did you have another question? Oh, okay.
Sorry,
On
no,
both hands.
I just
All
forgot to put
good.
my hand down. All good. Going. Goodbye.
No worries. Thank you. So coming back to the board game. So the first session that we did with Kyla was about a bit understanding the system and unpacking it and using that iceberg model. The second part of the board game is usually you start doing system mapping, and in the board game, they have different tools. In conversations with Kyla and Janine, we opted not to use these tools, but we wanted to present Sticky Studio and actually build a system map together. But in the game, there are different aspects of mapping the system that you would do and then bring into the center of your board game. Today, what we want to do is talk about, now that we have an understanding of the system, and I'll put a caveat, okay, our system mapping is far from being complete. It's far from being reflective of the reality. So in a real scenario, we would likely be spending a bit more time and go, okay, do we think our map is good enough to get to the next step? But for the purposes of demonstrating the tool, what we'll invite you is assume that our map is, what we know right now, and we'll start building off identifying potential ideas to change that system so that it will work in a better way. And I do like the Deming quote around, systems, are designed to provide the outcomes, or I'm going to mess up that quote, but do you have it, Janine, on top of your head? But I think some folks are nodding their head knowing what it means, but it's like system are perfectly designed to produce the results that they're producing, right? So when we're unhappy with the results of the system, often going back to how the system is designed rather than blaming the people in the system or looking at some things is kind of going, well, wait a minute, what if we could change part of the systems to actually get the results that we wanted? And so this is where we talk about changes and trying to identify those changes. And so in this board game, what system innovation suggests us to do is to look at different types of changes using these cards. So I'm just going to zoom in on them, and then we'll use these cards in our Sticky Studio. So system design. So here we would play this card to describe how we would go about designing or developing a new innovation in the system. So are there new things that we can add into the system so that it starts behaving, in the way that would lead to the results that we want when it comes to successfully aging in place? Innovation gap. It could be like, if we look at our system map and go, wait a minute, there's something that's missing to connect these two elements, or there's nothing that exists to support this, then we're closing kind of that innovation gap together and adding new practices, new processes or programs to the system to close that gap. You'll see it's not that they're necessarily super different. They just ask you to look at the system or the solutions different way. System gardening. So play this card if you see an innovation that needs to be supported and developed, and then post up how to support it. So maybe there's some things already emerging in the system, but they would need a bit more attention, TLC, to maybe foster and grow and have more impact into the system. So that would be system gardening. And then the last kind of cards or set of ways of looking at problem solving is pockets of the future. So play this to identify a new idea, practice, or technology that is representative of the future system we wish to create. So this would be, it's not necessarily the creation of something, but it would be, hey, in the future, it would be great if this component would be part of the system, and it adds a new idea there. So this is the board game, the bottom of it. And so what I'll do now is just go back to a Sticky Studio and show you what I'd like us to do as a team to experiment with these. So the 4 cards that I've just described are at the bottom of the map that Janine just went through. And what we'll ask you to do is, based on the map that's here, the element is to potentially identify some ideas you might have. And I'll just show you one that I did. So one of the elements we identified was what would be helpful for successful aging in the appropriate place is this notion of holistic and proactive care and life planning. And so kind of an idea of what we would like the system to have. And so wrote a suggestion around this pockets of the idea notion here. Is that inspired by La Crosse, Wisconsin, is maybe launch a program where everybody in the community is expected to have a living will. And so this community, La Crosse, Wisconsin, for those who aren't familiar, I think everybody in the community is expected to have a will for what's going to happen when they die. And so the idea could be, well, let's expand on this and say, well, how, and maybe it also includes a living will in that perspective, but this could be, how could we ensure that communities are encouraging members within them to develop this regardless of their age, so that when they get to that stage where they're aging in place, we already have a sense of what they would need, and that would allow the community to design those programs to better support that community, as an example. So what I would like us to do is experiment with this a bit, have you kind of drag some of these cards and then connect them to one of the post-it that is on the board here, and unfortunately adding another post-it to maybe explain what that idea is in this context of our system map. How does that sound as an idea to experiment with the cards, and what kind of ideas they give us to how to change the system? Getting a thumbs up from Janine. Tanya, do you have a question?
Yeah, I was just curious. So what I like about these cards is it's challenging us to think about I think, if I'm understanding correctly, also like leverage points. So are we trying to identify, like, obviously if we know of a program, but also where there's a gap, like that one that where there's an innovation gap or there isn't something, but we feel strongly that this is an area to intervene? Just trying to
Absolutely.
reconcile with leverage, like identifying leverage points. Or does that come after once you've put all the ideas out there? Like, where do we want to prioritize? It's just a
Absolutely. So I think it's always best to start with what you're thinking, what comes top of mind for you, Tanya. And then once we see everything, then it's coming back to asking the group, what do we think might be, where should we put our limited resources or efforts?
yeah. Okay.
That would be a second stage. But I think first is getting all those ideas on the board. And I liked how you framed it. So I think that's why the cards are a bit different. Where is there a gap? Where is there an existing program, but it doesn't have enough momentum yet to have the impact that we're so how would, should we support it more if it's having good results, or we think it would have better results if it received better support?
Is it okay if I add some comments?
Absolutely. Go ahead.
Yeah, and so totally agree that go with where you have passion or knowledge or expertise. And I would say also, if you see leverage points popping up, explore that, even if it's an unfamiliar space. And so I'm going to go back to where you asked about intergenerational interaction, successful or perhaps not successful. There are a lot of goes into arrows into that. In the questions we should be asking is that a key leverage point or not? Is there something we can do about it? And maybe the map's not quite right. Sometimes we look at it and go, yeah, that's not actually right. But are there other Post-its where there are a lot of going into and out of arrows? And preferably if there are a lot going out. It's like, oh, if we fix this, we could affect a lot of things, or a lot of things are affecting it. So you kind of sort of like leverage points and root cause. You want to trace
Okay.
things through. So find your
Now,
balance between I know about this versus, oh, I see this as an opportunity.
okay.
Mm-hmm.
And so just one other question then, in terms of if we were trying to work with others doing this, I'm thinking in the context of our organization and our work with older adults and community, the opportunity to really get the current state, the system map understanding, and the narratives that are coming through from this map first before we would go into working with them to identify the innovations and the leverage points, so that we're not circling. I'm sure there's still some iterative natures even when you get into that, but just like, I guess, testing the assumptions enough with the map itself. How far do you go before you start doing this part of the process? So like if you start with a small group, do you then go out to another group to share that map, tell the story, and then another group? Like, at what point is there some level of saturation that people are feeling that this is truly a reflection of our shared perspective? And if that's not the process, then how big a group do you have to have in order to feel that you've got some collective wisdom in the room and enough diverse perspectives to really feel that the system reflects what's happening?
Great question. Jenny, do you want to share based on your experience, and then I might build on?
That's a great question. And I'm going to quote a new colleague of mine. I work with a couple of nonprofit community healthcare organizations right now, one of whom does a lot of qualitative research, very much about affecting the health ecosystem. And when they go out and do their group discussions, mapping or otherwise, they stop when they stop the mapping process or the qualitative analysis process when things aren't changing anymore. So if we look at this as a group and go, no, we're still moving stuff around, and then you go to maybe another couple subgroups. So there's some personal judgment. Do you pull everybody in the room? I've done stuff like this with as many as 30 people in the room. It's really hard, but you can. Or do things with, several small groups of 5 or 7, which is easier for the group, harder for the facilitator, right? Everything has its pros and cons. But when things stop shifting around, you've got some consensus and you've got some stability in the wisdom of the crowd. Sometimes you can't wait that long though. So there's always some places where you have to make an informed decision and say, this is the best decision we can make based on the information we have. I know that's my 25 cents. Kyla, Amarie, or others?
I was just going to add, I think so in the original game of System Innovation, there's one of the cards that like the actor map, and it's something we didn't necessarily do. Who are all the actors in this system? Like we did broad categorization. So maybe in a first smaller group, if people start identifying the actors, and then you go, wait, who's missing at this table from this actor map that we should engage with? And then if you engage with them and they identify new actors, you go, oh, right, I hadn't considered those actors. So how do you engage them into that conversation until the exact same endpoint that Janine was suggesting, that there's no, even engaging with the new actors isn't, new information is not emerging, and it seems to be more, but at some point I feel like if there's also, because I'm assuming too, the system might change if you're taking 2 years to map the system, right? And then while you're mapping.
Well, I mean, and there's like to your earlier, like the first quote, we, fall in love with your problem. I mean, we don't want to navel gaze and feel like, oh, it's perfect, because it's dynamic and it's always changing. I wanted to understand, like, I know we're moving through this to learn the process, but I just wanted to understand, and thank you for adding that as well about the actor mapping, kind of what are the pieces that would really be necessary to kind of at some point being able to move on to the next step that we're doing right now. So I appreciate that.
They're excellent questions. Thank you, Tim. Okay, so I think you all, and I wonder if we need to put the link back into the chat, or if it's been provided to the Sticky Studio in case some new folks have joined. So I'll just copy paste it here and add it to the chat again. But if folks want to try to experiment by adding some of those cards, oh, I see it there again. Thank you. And then just seeing what kind of ideas, if you have some questions about the map and you think some arrows are missing, and that it would be helpful to add them back in, we also, can work on expanding the map if it helps us, but would like to focus on the change aspects and experimenting with those cards to get new ideas on how we might be able to shift the system a bit to get to the results we want around successful aging in the appropriate place. So for this part, I think I'll just let folks kind of work quietly, but we'll leave, if you have questions, please jump in. And we'll just work collaboratively together for the next few minutes. Any questions or challenges folks are having as you're navigating Sticky Studio, or?
I could improve my vision, I think that would help. It's like my eyes are glued. I'm like Kyla, I'm like, I can't read very well. So I have progressive, so I have like a bent neck trying to look at my screen because I need my reader part of my progressives here.
That's what I'm finding with experimenting with different mapping tools. It's like, which is the one that I can read best? Still struggling to find out which is the one I can read the best.
Oh, Kyla, we're getting old. Okay. So we're naming some of the existing innovations, right, that we know of. Is that kind of what people are doing as well? Or I see some actual naming of innovations.
Nice. Yep.
And also add something in that doesn't yet exist, but you think it needs to exist.
So like just basically saying we need something that might look like this or that would involve this, but it hasn't been like the initial idea kind of thing?
Yes,
Or just that we need an
absolutely.
innovation? Okay.
No, yeah, the actual initial idea.
Okay.
And the fun part about being in a group like this is somebody else might go, oh, we do that where I live. And then we cross-pollinate.
Yeah.
I love that. I bet you this is very, very interactive at some point for groups because this is all about ideas and solutions, right? So
But what I like about this is that you can kind of get a sense of like what, like the level of impact based on the number of arrows that are going in and out of something.
well,
So
and it's attached to context because before we're thinking of ideas related to change concepts related to driver diagrams and quality improvement work previously, and that, you know, that's missing a lot of context. So
right.
I really like that context as being the setting visually.
It should be very, I think this map, when it's done well with the right people, should be extremely representative of their experience and the complexity of their experience.
And
Because
the collective experience, right, Kyla?
right,
Like,
right.
yeah.
Because process mapping almost is still more the steps of the organization or the process, right? Like it doesn't take into account all the other influences and forces and things that mediate all of these sort of different interactions. So even though it's messy, it like really makes you think deeper about like where are the things, if we do have limited time and resources and energy or whatever, like where is the biggest bang for our buck?
That's a nice way of differentiating the process mapping from a system mapping. Thank you, Carla.
And more of the fundamental changes, I think, right? Like the redesigning pieces, not just improving possibly the bad system we already have, but like really thinking about like how do we actually change this?
Well, and I guess the mindsets and the, you know, if you had, and I, sorry, I can't really, but like if we had a thing, I think at one time we were talking about the implications of ageism and I think, anyway, but those types of more deeper rooted things that need to be addressed, in addition to the surface kind of pieces that need to be tackled.
Yeah.
The structural, all that kind of stuff.
I don't know why, but what you were just sharing, Tanya, makes me think that because of workforce shortages and across a lot of industries, some organizations are thinking about, you know, how do we how could we make sure that we don't have ageism within our organization, but maybe some people in terms of older adults may want to work a bit longer, like either financially or for whatever reason, but maybe not 5 days a week, 40 hours a week. And um, so we didn't talk about that or explore that in this map, but so it makes me think of a whole other area we might want to explore for this.
And I just drew an arrow in my head to purpose, and what that can do for an older adult to have purpose in their life, and what that does to social isolation because they're out, even if it's like a day a week where they're working. I know people say, well, you can volunteer, but it's like, why not be paid? Because there's a lot of fixed incomes that, you know, and then there's a spin-off of how we might allow like less taxation, because a lot of older adults will worry about the level of income they're making because they want to keep it at a certain level so they don't get they don't have to pay a lot in like income tax. So yeah, interesting. See what it does? It just makes your brain explode. Like you can't you can't stop thinking about all the implications.
Well, and the insight I had, I think, from our last session, which I think, Tanya, you're kind of talking about, was like, I had this idea of like, why don't we do sort of like what we do for little, when we have babies, right? Like you get the prenatal care, you get the month or the visits with all your immunizations, and they do developmental milestones checking, and they refer you really early to early intervention programs, and like make sure you're like getting a head start and reading to your kids, and like
that was such a mind-blowing idea, Kyla, that when you said that,
why can't we do that for older people too, right? Because they are on a trajectory, and how do you kind of get ahead of the things that might be coming down the line for them? So that was sort of, I think I put that in my system gardening or maybe innovation gap, where it's like, how would we be more proactive in our aging care as we are in our early childhood care? And then I thought, well, it's because of ageism, right? It's because of the value that we put on youth, and not the value that we put on people as they age. And
well, what we reduce it to, Kyla, is like my father, who's got chronic disease. So it's kind of your every 3 months you get your kind of checklist of all the things you need to have done for your diabetes, or, you know, and so we've reduced that kind of idea into a disease category instead of a wellness category that we have for babies, where, you know, let's test their hearing, let's make sure they have, you know, all their immunizations up to date. Now we do that with older adults. We recommend that you make sure you're up to date on your immunizations, but are we calling people back as older adults to say, hey, do you need a ride? Like, you need to get this done. And is there a way we can facilitate that? So it just, when you said that, I was like, oh my gosh, it does speak to ageism, but it also speaks to like how you can take an idea from one life stage of the life cycle and apply it to others. Like, why not? Why not? Right?
I wonder if there are some folks in the group who would like to share maybe some ideas that are emerging as they're placing them on the chart, so we could start exploring what seems to be popping up.
If I can, I'm going to make a comment while people are gathering their thoughts to answer Marie's question. So the other way we can cross-pollinate is, as you all were talking, and you know, we've talked a lot about caregiver burden and all the transactional weight of that. But people who are aging and get that checklist every 3 months for their disease, they feel a transactional burden of, my life is now a medical checklist. It's terrible. And if we kind of blend all those ideas and take what you were saying, Kyla, and say part of this proactive is, in addition to your medical clinical prep and your legal financial prep, there's social prep as well. So here's a fun fact. When you're in your 80s, the music you most want to hear is the stuff you liked when you were in your 20s. But your family has no idea what those songs were. And so there's actually businesses around this. There's one called SingFit, and it's all about profiling the music that was popular. So if you're 80, it profiles the music for you that was popular when you were in your 20s. So having a journal through life that says, here's what I liked to do at every stage, so that when my grandkids come and talk with me, they got like a cheat sheet. And all of a sudden we're having a better intergenerational interaction. Because I know my nephews have no idea what to talk to my mom about. Like, no idea.
Mm.
So anyway, connecting dots.
I'm seeing a lot of
Anyway.
support for your comment around music, Janine.
It's great. If anybody has not seen what's the guy's name? Tony Bennett's video. So do you all know who Tony Bennett is? Singer?
Yep.
Yeah. I think he's passed at this point. I'm not sure, but he has or had Alzheimer's. And the last video that was made of him, he was on stage singing, like on stage singing. He was normal, inclusive of recognizing the people around him. So there's a video of him recognizing Lady Gaga because they did a lot of duets together. But take him off that stage.
Nope.
Yeah, the power of music and dance is amazing. Anyway, I'll like stop now and let people answer Marie's question.
Yeah, so who's ready to share some of the ideas that are emerging as they're using the orange cards on the board? Or I wonder, maybe what we could also do is just go where because I see in this blue area, there's a lot of innovation gaps. So do you want to talk about these innovation gaps around mental well-being and social isolation?
Is there anything for transportation in there? Sorry if I missed it. Oh, there it is, transportation services. Thank you. Thought no.
I think where I see gaps is like outside of the medical model that we've like our mindset has been so in. So I think there's just so much opportunity for innovation outside of medical care that people aren't really, or maybe there is some stuff starting to kind of pop up. But I think there is a growing sense that like this has to be taken care of outside of the healthcare system or alongside the healthcare system or before the healthcare system. I don't know what, but like I just see so many gaps in that space. And I don't know if and I think maybe part of the reason is like, then who owns that? If it's outside the healthcare system, then healthcare is like, well, that's not mine. And I don't know, do social programs see, like government see their role in that? Like, I guess who sort of like, is that entrepreneurs that are meant to fill those gaps? I don't know. So, that's where I get a little bit like, oh, I've always worked in the healthcare system or with the healthcare system. So I don't know like who else would do this. But I feel like the healthcare system's too focused on delivering healthcare services to ill people.
But that might
I
be
think
what
on
the
that,
capacity is, right? Like there might not be the capacity to expand beyond that, as we know the human resource issue that's there and the amount of illness that does exist. So what I'm curious about, what you shared, Kyla, was just the amount of small pockets of innovation that is happening, whether it's through volunteerism or it is entrepreneurs who are trying different things that we're just not connecting dots, as Janine said. We're not raising the awareness and then creating a bit of a cohesion or a business case or just something to make things more sustainable. Right. Sue, go ahead.
well, it was on those lines. Yeah, I was saying, I think it's not owned by the health system at all. I think it will happen through other ways. And then I think the health system has to catch up to follow and see the roles they play within the whole pieces of, but I think I think there are a lot of work that we done outside the health system and is already being done. So how can we then learn from it? And then align with where health system is so disease focused, as we were talking before. And then when we're not there, we are talking about wellness. So then how to really get to that prevention state as health is connecting with and start learning how things are being done outside its own bubble, but also knowing impacts it so much.
And
So I
I
think it's
also
more like
think,
a catch-up game, I guess.
yeah, yeah. And my mind's going to, like, again, system thinking, like on Janine's comment, like there's something about the fact that we're talking about a health system, a wellness system, of which care delivery is a part. So there's a delivery, a subsystem of delivery of care. There is kind of the prevention, you know, like all of those pieces, but we are maybe in our mindsets are stuck in the silos. And I think we have to figure out how to broaden everyone's thinking to see the role that they're playing within that. I don't know. I think we have to kind of raise up a bit, 30,000 feet view, and understand how all those parts fit.
And that just makes you think, just to maybe add, and I see the great questions that Janine is adding into the chat around, can we redefine healthcare system? What does that mean? Or is there a business case, to look at the business value of these innovations? And how does the work outside of the health system sustain itself? Maybe to add, a post I saw recently was suggesting that to solve healthcare, you can't necessarily just disrupt the healthcare system, but they were suggesting that the way it will change is more through local and community driven kind of change. So, and if you look at a lot of the ideas on our board right now around the type of activities, so if you look at the community and what's within that community, you're not looking at it just from the health system perspective, but you're looking at it from what are all the parts in this community? How do they interact together? How could they support each other to take care of the people in their community? But yeah, the act locally. So you get away out of the health system, but at the community level, and that changes a bit how we view the parts. So who would like to maybe share some of the ideas that we're seeing here around the blue Post-its, around, the availability of those social services, and ideas around, provider sponsored or community sponsored, digital simulated interactions? Social prescribing, navigation, house calls on demand for preventative and intermediate care.
I like that idea, and it's been kind of explored here in my province around these like teams that you have access to 24/7 that can come help you prevent sort of things from getting worse, or do early testing, or even sort of intermediate care where it's things like home-based antibiotics. But I just feel like that would give a sense of security for people who want to stay in their home, or who have family members that are caring for them. I think that part of the burden is like not knowing, like, what if something goes wrong? How do I get them to the doctor? How do I get care? And then there's the whole that emergency. So yeah, seniors house calls, there was a program like that. I don't know if that's still here. But that was initiated, I think, before COVID. And maybe that's changed a bit, or maybe it is still around, but I'm just thinking, like that would just be such a great service for people who want to kind of who have trouble with transportation, who have trouble with mobility, who don't have care physicians or care teams at their demand.
I'm curious to hear more about social prescribing. I don't know who put that there, but you've piqued my curiosity.
Oh, sorry, that was me. I'm struggling with the technology. No, I was just drawn to and I don't know if I'm doing this right, so my apologies. I watched the first two recordings. I'm just trying to jump in here, but looking at the well-matched services, and we know at home here in Saskatchewan, we're just starting on this journey of navigation and bringing social prescribing, of writing a prescription to be able to match people with those appropriate services in community. So again, a lot of pockets, I would say, a lot of buzz around the navigation, but how that's playing out is very early. But I think there's a lot of opportunity here to see how that works.
Who does the prescribing?
Pardon me?
Who does it? Who prescribes?
Yeah, it's a community connector. So it's someone usually embedded within the community. They call them different names. My team, please help me jump in if I'm making mistakes. But yeah, it's someone embedded in the community who I guess they do some asset mapping to understand everything that's available in the community. And then the prescription is written by the medical provider. There's other people like maybe pharmacists or, nurse practitioners can write a prescription for a social prescription. And then it's picked up by the community connector who meets with the older adult and then connects them with the service.
Mm-hmm. And it could be self-referral as well.
Yes, thanks.
Mm-hmm. Yeah.
That gives it some formality. That's interesting. I'm imagining like the wise elder of the community who's looking around going, these people, this person needs that, and this person needs that, and then collaborating to help make sure it happens.
Mm-hmm.
Intriguing.
So there are two layers as well for that, because then I feel like Jen was saying, it has all the asset that is trying to understand what the community already have, but also if they don't have, it shows the gap. But then with that gap, not necessarily would be able for the community connector or the link worker to connect the person to the services they are interested or they need. So there's that perspective as well, like social prescribing. At the get-go, it would kind of work well if they already have in place the services that are needed. And then if like transportation services, for example, we have like as a sticky note, if that's not in place, it may start like movement for conversations and maybe finding ways on how that could be addressed.
Thank you. A few more things in the chat coming up around Kyla sharing an article about a walking football program that physicians can socially prescribe for their patients. And so it's a creative partnership between, the local football club and the NHS.
I'm still circling around Kyla's mind-blowing idea around the babies and children's wellness program and developing one for seniors. But my thought in combining that with social prescribing, one of the challenges here is they're hiring these navigators, these community connectors, and it's like we have to rely on a prescriber to identify that there's a need. And right now it's predominantly around family doctors. And, a lot of folks, it's end of line type of thing where that's where seniors are ending up, because if they can get access, it's kind of like they're at the point where they're struggling. But if we had a preventative wellness program, could these community connectors not be buddied up with the seniors in their area to help them with navigating that program, like, phoning them to be like, it's time for your immunization, it's time for it's whatever the piece of, and you could build social activities into that wellness program and making sure that they're partaking in that kind of comprehensive program. And that would be kind of like their mainstay role. They develop relationship and trust with those seniors in those areas. And then when additional services come up outside of the wellness program, they're ready to help them. And they don't need to rely on a physician to prescribe and connect them to the senior. They're kind of a role in and of themselves in the community. Anyway, I just wondered if that would be an idea that maybe we could play with, because I think we were also talking about the bridge between how do we get care delivery system to see their role. And I think it is in the preventative care world. And I think people can wrap their heads around baby wellness checks and that whole, home visits, all that kind of stuff. And it's like, can we develop that for seniors? Oh, well, who's going to do that role? Well, what if you've these already hired community connectors be kind of like the navigators for that? Anyway, just a thought.
Yeah, thank you for those ideas. Is there anything else we want to explore together on the mental well-being or social isolation before we move to another set of colored post-it?
That's a lot of interesting ideas.
Yeah, absolutely. Okay, let me just see. I'm just going to try to move.
Just as a note, I know I mentioned this here at our space here, but I'll share here. There is like similar to what you just described, Tanya. There is a program. I'm originally from Brazil, and there's a program that the worker does that. The health agent is health worker. I don't know, is hired by the health system, and they are the ones doing that connection and that checking in and understanding about vaccination. So it's just like it's like, yeah, kind of a links back to that perspective on what is being done for prevention.
Yeah. Before waiting for the really expensive care later on, there should be financial ways to support this because we often wait for people to get to the emerge department and a bit more expensive than the preventative program. Okay, so moving to the housing option. So this section around the yellow stickies that we had here. So, the generational housing that we talked a bit about earlier, incentivize non-familial intergenerational living, so domicile care, other forms of that, cultural policy support for it, housing option capacity. So here I see there's a few buckets around system gardening that were there. Was it about just increasing those ideas already that are existing? Another important idea here. Yeah, I see Belize where your cursor went for a moment here around the multi-sector collaborations and redesign of the housing solution as a system design idea there.
Yeah, and Mary, I think I spent quite a bit of time looking at these housing stickies and trying
Nice.
to align it with the orange stickies. I don't know what I don't know. That's why I went with the system design, redesign when we were discussing it. I'm sure there are ideas, uh, and there are some innovations that we know about, but how do we like bring those forward so that multi-sector collaborations popped up in my mind. So I put it up there.
No, thank you. And I think it aligns with what we were talking about earlier about how do we find, so some of the solutions are outside of healthcare. And so when it comes to housing, definitely that's not a healthcare problem per se, but it has a lot of impact on the provision of healthcare service. So that multi-sector collaboration and redesign of housing solutions. And I think it's another example of something that is done locally.
And just a process
Who are all
question,
the
maybe. I mean,
sectors?
Oh,
Police, when you say multi-sector in your mental model, what are all the sectors that have to come together to make that work?
so I had health in there, but housing, education. So those were the three that popped in my mind.
Yes.
And in terms of process, so I don't want to derail, maybe at the end we can discuss it too, but the idea is that we shouldn't get too hung up on the orange stickies and what they mean or anything, but the discussion is what we are after, right? Like, okay, I'm seeing Kyla. Yeah, perfect. That helps. Thank you.
absolutely. I think the intent of those orange cards is to have you think about ideas for solutions differently. So sometimes we only think about adding things to the system. But gardening, I like the concept of like, hey, how about we, foster or provide fertilizer to ideas that are already in the system, right? And make those better. So they're just different lens so we don't get caught up in one way of looking at solving a system. That's it. And in my view, if somebody interprets the card differently, it doesn't really matter, like as long as it generates kind of a new idea for them. So I don't think there's any point to go, well, that's not an innovation gap. That's a act like that doesn't necessarily matter as much as did it generate a new idea that might be useful to this problem that's worth supporting. Are there
Yeah,
ideas in terms of housing
I
options?
can
Go ahead, Tyler.
really see the role of system convening in these challenges, right? Of like bringing these people together to talk about solutions. And, you know, I don't know if there's enough cross-sectoral spaces to have these conversations and discussions. And so without, I think, a role of somebody bringing them together, I don't know how naturally those things occur. So to be sort of intentional about a process of also bringing them together and realizing that it's multi-sectoral, okay, well then who's going to bring them together? Who's going to write the proposal? Who's going to, you know, how are you going to ask for funding? What funding opportunities are there across all of these different sectors? Like there's a real sort of facilitation role in hosting and bringing these people together to collaborate as well.
I think that's a great insight, Kyla. And I wonder, like, my understanding is in the fourth stage of the game, you start digging into those things. Well, wait, if we think that this matters, how do we start making it happen? So those are, if people think that that is an area that would like, yes, when it comes to housing, I think if we could get this multi-sectoral collaboration, it'll get things going and shifting, and that's likely a big leverage point. Then all those questions you raise are helpful to unpack that. I don't know if you want, so Tanya, yeah, your question, or Janine, you wanted to build on?
Well, I was just going to build on what y'all were saying, and some of the comments in the chat for the multi-sector collaborations on housing. So I put in the chat, there's a growing trend in the US for these over 50s communities, like big social communities, not really retirement, but they fly in the face of this whole concept of intergenerational interaction. And they're, I would call it capitalism driven, right? Some real estate company figured out a way that they could attract different kinds of tenants or buyers. So it's all real estate driven, but with slight tweaks, slight cross-sector collaboration, they could adjust their model, still make their money, and also be conducive to health considerations and well-being considerations. Like it wouldn't take much.
Mm-hmm.
I think this idea of, you know, in a neighborhood, one of our, Kyle, I'm thinking of Dan and what he was sharing about the idea of not unlike where you've got these big multiplex 50 plus seniors, but what if you took that idea and actually decentralized it and made it that there's maybe homes, natural occurring homes in a neighborhood where 10 older adults would live, but they're part of the community. I mean, these care homes exist, but they're not integrated. And it's the idea that, you know, you have a school and you have the church and you have the grocery store and you have, you know, there's the care home and then you have the preschool and you've got but that there's more community interaction happening. And that's I think it's a bigger cultural barrier or a societal barrier because we all drive home into our garages and shut the door and don't talk to people. Like there's still some of that, you know, people don't really want to interact. But to kind of fight against those big entities, because my dad lives in one and it's, yeah, great, the services can come there, but it's also can be very, so like you create other issues, right? Like there's cliques that form, there's, you know, it's just kind of weird. And if the activities they do aren't the ones that the older adult, you know, a lot of these folks move in from rural areas and they're like, give me more garden plots. Like they, you know, there's just this little space they can go out and grow their tomatoes and they're like, that's, you know, I don't want to go and listen to the band and do the old time dance. So I think, you know, the idea, to your point, of being capitalist driven, but also I think it's the ease of delivery of services that drives that we should just corral these people in a place and then we can bring all the services to them versus thinking differently about like urban design and how we create communities differently, because we always talk about the parks and the school and that'll draw people. But what about if you created these smaller care homes that were just, you know, smattered across a neighborhood and how they interact and get part of a community. So I think there's some urban design or city design aspects that could be thought of differently.
Thank you for that. I
That are
captured that in
integrated.
a sticky. Yeah. So I think the multi-sector collaboration for housing, there's also a broader element to it around the urban design.
I think
Yeah.
so. Like we've got so much urban sprawl happening. Like I live in urban sprawl, and like I just think that what are the selling features they're touting, right? But like, what if you actually thought about putting in some of these other facilities that are like homes that can specialize, and then the community recognizes that as being a feature and an important part. You can grow old in this community, and we will take care of you. If you buy a house here, we will have a place for you. You know, that kind of thing. So.
No, thank you for that. So we have about 23 minutes left before wrapping up the session. I wonder, is there anything else on housing before we move into the caregiver family aspect, the pink stickies?
I know it's not on the stickies and maybe not necessarily where we're focusing, but I think the affordability of housing, I feel like from what Tanya was sharing and you guys, like I feel like there's so much on those examples that are not necessarily equitable, or you know, like how to build that into it. And then we've been hearing a lot about the affordability or not necessarily being able to have the means to keep the home. So I don't know.
Yeah.
Well, and there also almost needs to be like again, a business case or like a financial review of like the cost of long-term care versus the cost of like community-based smaller care homes, or I don't know. Yeah, like maybe that's already been done. Maybe somebody's doing that or figured that out.
Yeah, I know just in Ottawa, there's a part of town that there were a lot of like small homes in there, but that whole area is in a very favorable location. So we started to see gentrification. And so the taxation in that community really rose. And some older adults had to move out of their house because although their house was paid, they could not afford the municipal taxes. And I thought that was horrible. So you paid off, you don't even have a mortgage, but you can't pay. Because I think the taxes were like in that area were like 12,000 or even higher for, and they just couldn't afford that. With, imagine you've paid your, but can't afford the tax because of the location. That became, yeah. So I did add the concept of affordability to one of the post-its around housing options, capacity, and affordability. Yeah, and other expenses too, absolutely. Okay, so let's move to the pink ones just to look at the aspects of the ideas that emerged around. And I think we did have a bias around this as Janine expressed, just because of the audience and who we are participating. Sorry, I'm having issues navigating here a bit. So the family, friend, and caregiver post-its are all the pink ones. And in here, the ones that we highlighted, like caregiver burden had a lot of arrows coming in, holistic and proactive care and life planning was connected to that, and successful generational interaction, which that's how it connected to the housing there. But what are some ideas that emerged around here? There was, yeah, and some connections, I guess, to our system gardening around those, the connection to the point Kyla made around aging care, like early childhood programs, day aerial programs.
What's Aereo?
Is that something Denise added? I think she had to leave.
Oh, that's possible.
I know they have day programming for Alzheimer's, individuals with Alzheimer's, but that's all I've ever really heard of is like respite day programs for that. I don't know if they have sort of like drop-in day programming, whatever, for other older adults, but maybe that is an option.
And again, if you had these smaller centers in neighborhoods where older adults weren't quite ready to make the transition, or they could run programs out of those homes to support those who are still living in other housing. And then I was just thinking about Jen and Chelsea, like the nursing home without walls idea, like those community navigators could be based in neighborhoods
Yeah.
in those homes as well. But they're, yeah. I feel like we need to, there's a balance between just working with the innovations that are existing, but also maybe some, all the good ideas, bits of all these good ideas, and maybe a transformational type idea to try and innovation to try and test. But it would, I think we need some other perspectives and sectoral thinking
Yeah.
to augment it.
Yeah, I was thinking about technology a little bit. Like we are not mentioning it too much. Probably we don't know it much, but there's a definite role of technology for the caregiver burden, like less phone calls, less tracking of certain things. Did I hear it right? Like we are going to appointments to 3 people just to make sure we are not missing anything. So I'm sure there's an innovation there. Someone could help.
Absolutely. Because I know here in Ontario, in Canada, the province that I'm in, they have these home and community care, right, programs, and they have these kind of like community navigators, and it is challenging for the clients or even the caregiver family to understand or have access to all, like there's not that transparency or sharing. And so when it comes to technology, it feels like something that could alleviate the burden on those community navigators to share with the family or like the client themselves, like here are all the services or the access or the timing or appointments, and having more of that engagement, not just a one way, like here's what we booked for you, but using technology to really create that connection.
Almost like a shared family calendar, right? Like you're connected with and it's like,
Yeah.
oh no, I can't change this. I've got this coming up. So yeah.
I think like technology like shared calendaring, that that's application development that can definitely be done. Going a step further, like here in Pittsburgh where I live, every year they publish, I think they still publish a physical book, like Aging Services in Pittsburgh. It's all county specific, and you have to research it. What I can say as a caregiver, in addition to the tasks, one of the hardest things is the amount of personal research I have to do. So what I want tech wise is a tailored chat GPT for this.
Yeah.
Right. I don't want chat GPT in general. I want the app. So, and a lot of companies are doing this in other domains, like building the specialized open AI for the domain concerns. So I want that for this. Like, here's what we're going through right now. Here, and it has to be in a private sandbox, right? Here's the medical history. Here's the social history, because now we have Kyla's journal, etc. And then it spits out at me, here are the 5 things you need right now, and here's where you go get them. That would be gold.
Now that Apple's in the scene with ChatGPT, we'll see what happens. It's like, oh no.
Yeah.
Yeah, no, I think that's fantastic. But again, how do you, so that then you have to build awareness and trust with people with those systems that are being designed and how that information will be used, right? But you're right, Janine, like we do that here. There's my dad's got, like, it has to get updated, and sometimes it doesn't get updated, but it's like that thick. And you're like flipping through and you're like, well, and then people just start asking for, like, they'll go on a Facebook group and be like, can you recommend? And then you get this list of people, and that's the next best thing, because you don't know what these groups are like and what they do. So it's word of mouth.
Yeah.
Yeah, I don't think we even know what the future holds with AI and what's going to be coming out like, it just seems to be changing monthly.
The disruptor for sure.
How do we harness it?
And
it's another one that has to be private, local. Like there's not a universal solution to this. Like it's like a lot of these other things. Maybe we need some universal concepts, maybe some universal technical capability, which I think already exists with the OpenAI platforms, but the builds have to be local.
The local applicability, yeah.
Yeah. maybe even inside the health system to manage privacy and whatnot.
So before we wrap up, I wonder, we could continue exploring some of these ideas, but given kind of the focus of the session, which was to explore the system thinking tool and the approaches, I wonder if folks would like to just wrap up the session with kind of the experience today we had using these orange cards within the context of our system map. What are some lessons or sharings that maybe we could wrap up with?
Hi, folks.
Go
I
ahead,
can hop
Chelsea.
in. Nice to see you all. Sorry, I was so quiet today. I was just soaking it all in. I also missed the first two sessions, unfortunately, so I was just trying to wrap my mind around, bits and pieces that Tanya and Kyla had been bringing us along in. Really, really appreciate this session, and some really cool ideas came up today. So I've been screenshotting the chat and adding them to our hopper, and I can totally see how this would be, just an excellent tool as a bit of an anchor or underpinning for a conversation that builds over time. So as you may know, I am leading the Thrive at Home work here at the Health Quality Council, and as a starting point to wrap our collective minds around something like a systems map to kind of anchor the conversations in our roadmap going forward. But I was thinking about or the beginning of the conversation where Tanya asked, how do you know if you're done, right? And it's like, well, there's no clear you are done end mark, but when the conversations start to become saturated, or you get those themes or nothing new is emerging, and that might take a period of years, right? So kind of starting to think about what's the straddling between enough information to take your next step while also kind of being committed to capturing your ongoing learning. So just really grateful for the conversation today.
Excellent. Thank you, Chelsea.
I can go next.
Go ahead.
Yeah, no, I was just going to share, it's so interesting to go through the process. I think key reflections for me are at Lisa's comment, this is about the discussion, right? And I'm like, yeah, and I can see in this particular instance how it's going to open floodgates with the groups we work with, because that's just always been my experience where they're anxious to talk about solutions. But the key difference will be having the discussion about the context. And then I think, also thinking about the repercussions or the consequences of certain things. I think right now, as Chelsea said, we've got a lot of innovations in Saskatchewan that are being done, and just situating them across the system map to know what they're actually addressing and what might be not being addressed, and how that's important to kind of think about. Teaching people about the importance of context in improvement work is really hard. And that's why I think, Deming talked about an appreciation of a system, and we kind of go, oh, yeah. And then we jump into the other stuff. But I'm back to the appreciation of a system, and I think I'm just going to hang out there for a long time. The other thought I had, and it was just, and I know we didn't have time, but I really appreciate the system map as being a way to tell a story. And I think, as we kind of, depending on how we parse this out with different groups, and we want to test our assumptions that we've made with each group, being able to kind of fine tune that story and really tell the map as a story. Like, I think, Janine, you were starting at the beginning to kind of talk about, or Anne-Marie, you were talking about the kind of this part, this cluster, and then here in the center, this is kind of where we were focusing a lot. And this is what's happening there as we see it. And what do you see? What's missing, or have we got it wrong? Because I think these little clusters are kind of subplots in a big novel, and these stickies are kind of the characters, and there's these arrows are the verbs or the actions that are happening. And I think we have to maybe translate it to people in that way and see if it resonates for them, because really we're hoping to generate a ton of discussion, and really solidify the collective wisdom to tell this story of what's happening right now. So I think lots of light bulbs have gone off for me. So thank you very much.
Thank you, Tim. Other observations?
I think I'm more curious about the next session now, where it's like, now what do we do with this? How do we like, you
yes,
know, 'cause, and brainstorming with new ideas is like so fun and awesome, but then it's like, now what? How do we move forward? So my curiosity is piqued for the final session of this series to consider, and you know what, that might be something we have to figure out together, like what would we do with this, what would be most effective. I'm also intrigued by this idea of like then taking influencer mapping and thinking about, okay, well then who has the influence, who has the power, who holds the funds, who, you know, who do we have to target to introduce these ideas to, who do we have to like, who are our champions in this space. So so yeah, so those are like just teeing up for the next session, the curiosity I
yeah.
have, what you do with this next.
And so I think that's a great segue. Oh, go ahead, Jenny.
No, go ahead. Go ahead.
I was going to say, I think that's a great segue. So you'll see that Paloma left in the chat a link to register to the next session. That's exactly 2 weeks from now, same time, same place. And then I think that what you suggested, Kyla, I think is we'll plan for once you've generated these ideas as part of this process, what is that next step? Because often, you know, people are great at generating ideas, but it's just an idea. It hasn't become real yet. So how do you use this to, you know, really connect it back to the system and make these ideas more than just concepts, but turn them into reality would be a great focus of the next session. Janine, what did you wanted to say or add to that?
No, similar sentiment. You know, and there's somebody mentioned early on, what do we do when we have scarce resources? So the idea of the system map, it helps us find the leverage points, small interventions or sometimes large interventions that will make an even larger difference because we have scarce resources. But when we have a lot of ideas like this, we still have to choose.
Yeah.
And, you know, what is the art of decision making? And then business case development and pitching and crafting the narrative, right? Because sometimes the best idea isn't the one that wins, actually.
Yeah.
So it'll be a good discussion. I'm curious if out of all of the various ideas, if there's any one or two that people have any, like if we were multi-voting right now and you each got 5
Okay, yeah.
votes, you'd be like, it's the one at a gut level. We always validate our intuition, but is there one that people are going like, I really want to do that idea?
Then I wonder with that, so I don't know, it was also something we had a discussion here in another event that was like, when they're going through those ideas, what does idea mean? Is it like one, like social prescribing as we have there, or whatever, or is something else more working like multi-sectoral? Like, is it interpreting those yellow stickies? How then we guide people kind of process-wise to not really just narrow down to one activity?
I think it would depend on how the group is interpreting it and where there is the energy, I would say. So if like social prescribing feels still very vague or whatever it would be, you know, I think that has a lot of potential. Let's define further what that means, and then let's build out how we can make this more real. We had a bit of a conversation around that today, but if the group felt like, oh, I'd like to understand that more, and I think that's where there's the most potential to support this, based on Janine's question, then we could impact that further after collectively.
Okay,
And I
thank
think
you.
it's who you have in the room, right? When you're having that conversation and that discussion, like you might have made your map with like many different people, but then who are you bringing together to have the next conversation and decide? And, you know, who has the resources to invest, or who's going to commit the energy and time to pushing forward an initiative? Like that's also something to consider.
So is there, I know, so you mentioned social prescribing. Is that the issue? Like, you could always check in back on the next session, but is there another topic folks would like to unpack a bit more and see how that could work?
I think something else we were talking was the multi-sectoral piece on housing that Belize mentioned. I'm not sure. It was what highlighted for me today.
Yeah.
We kind of
Okay, so we have two, social prescribing and then the multi-sectoral collaboration for housing.
There's one on the chat and May about
Thank you.
how do we replicate the things that we are doing for babies for older adults as well.
Oh, yes, that was another one. Yeah.
I think that was a
Okay.
burning one.
Great. So I've taken note of those.
Urban design.
Okay. Is there anything else that we should mention before we wrap up and regroup again in 2 weeks?
I think I'm going to post a thing on LinkedIn to ask people what tools or strategies they use after sort of a mapping brainstorm of ideas. Like, how do you kind of decide? How do you converge? What are your processes? Just to see if we can generate any external kind of ideas or processes that we might not know.
Well, I'm wondering too if it might be a good exercise, and I'll maybe try and take a stab at this, but I'll need to work with our HQC group but like, what is the story out of this map? Like, let's actually tell the narrative of this current state that we've mapped so far, because I'd like to kind of synthesize a little bit about what we're seeing. I don't quite know what that looks like, but I'd like to take a try, because I think if we facilitate this, that's something we want to try and have folks take a stab at, is tell us, the story in this cluster, what's happening here, and then we kind of try to put something together. And how does it relate to the cluster?
I think that reminds me of the concept of theories of change, right? When you kind of write down, like, we're doing this because we see this impact and we observe it. So yeah, that's helpful.
Yeah,
well,
and
thank you, everybody. Oh, go ahead.
We don't have the next session fully planned out yet. So, all your ideas about what would be helpful to you, we can kind of incorporate into the next one too. So yeah, that sounds great.
No, thank you, everybody, for showing up. I thought it was a very interesting conversation and explored things I hadn't considered before. So great learnings and tips on how to work through these two. So I'm happy we did both, right? Solving the problem, but understanding the tools. We kind of meshed those throughout. Thank you for that. See you in 2 weeks.
Everybody.